Are you confused on whether you should be having a deep plane facelift or a mini facelift? Then this is the right video to watch. If you feel that you've got sagging and you have made up your mind that you need to have a facelift, then which is the right facelift for you? I am Dr. Ashish Davalbhakta. I'm Director of Aesthetics Medicine and Advanced Aesthetics in Pune and also the lead aesthetic plastic surgeon at My Aesthetic Plus in MGM Medical College, Navi Mumbai. I'll tell you a little bit about the history of facelift so that you understand where did it all start from. So facelift first started more than 100 years ago in Europe, where they would just take away the skin here and stitch it together and hoping to tighten the skin and give a lift. But what was observed over time is that the skin relaxed. The tightness that they had achieved by the excision of the skin disappeared, because the skin has a natural tendency to go to the least tension in the skin. So it again relaxed and the sagging reappeared. So the longevity of those results were hardly a few months or a year or so. Plus, if you tighten too much, you put a lot of tension, then it started looking unnatural, plus the scar would stretch, because too much tension on the scar makes the scar stretch and they look ugly. So in Sweden, the technique of going underneath the layer which is there under the skin, which is called smash. So there is a layer under the skin of fascia and fat that we can lift up. So that technique was developed, and since that time all the development has been in the what is called as the subsmash plane. So the subsmash facelift is the deep plane face, and if you go underneath the smash and release the ligaments which hold the skin to the bone, then you can lift up everything properly. So that is the deep plane facelift. Anything short of that, if you are only going under the skin, putting stitches on the top of the smash to try to lift it up, they are called mini facelifts. So that's the difference. Anything that you do above the smash, manipulating the smash from outside without lifting it up, they are mini facelift techniques. Max is also a type of a mini facelift where you are putting stitches in the smash. That layer which I said helps in holding the skin. That layer, if you put stitches, it's called max lift. So which one is good for you? So when you are doing a mini facelift, yes, you do have to take slightly smaller incisions, and you don't have to manipulate so much. The operating time is less, the downtime is slightly less, but the amount of lift that you get is also slightly less. So who would this work for? It would probably work for somebody who doesn't need to have too much of lifting. So you are just starting to age and you're thinking about lifting the little bit of sagging that you have. Maybe you can contemplate a mini facelift. But the moment you have fair amount of sag, when you have deep nasolabial folds, you have what is called as marionette lines from the angle of the mouth downwards. If your angle of the mouth has started dropping down, if you've got jowls here, or you've got a lot of loose lax skin, then you need a deep plane facelift, because that is the plane where you can go underneath, free all the ligaments, pull it up, and the tension and traction is put on the smash. So it's not on the skin. The tension is on the smash, it's all lifted up, and the skin just sits there approximate without any tension. So the scars are really good. They heal well with barely visible scars. So this is the difference between a deep plane and a mini facelift. Come for a consultation here. We would be happy to explain the differences, and we will discuss which technique suits you best and which one to go for. So if you found this video educational, do like it, share it with your friends who are bothered with sagging of the face, and if there are any comments, I'll be happy to answer them, and hope to see you at the next educational video.